Greetings, Eric Backer, naturopath from New Zealand. Thanks for checking out the video. What do you think of my new shirt? It's pretty cool, isn't it? Right, we've got a lot of questions to go over. Here's an interesting question I got from a YouTube subscriber who's asked me a similar question a year ago. In January 2016, I posted a video on the tinnitus and Candida link. Well, since I posted that video, I've had a lot of people contact me with tinnitus. And the interesting thing is stool testing has shown some remarkable things with a lot of these patients. Lack of beneficial bacteria, very bad bacteria like Citrobacter, multiple Candida strains, and in some cases parasites. Inflammation in the bowel I've also seen with tinnitus. I can tell you now, I'm almost certain there's a link between tinnitus and either Candida or low levels of beneficial bacteria, bad bacteria or parasite or some type of a bug. There's a big connection between the small intestine and different parts of the brain. Now we know this through a major nerve called the vagus nerve that connects parts of the brain up, and different little nerves, small branches of nerves that innovate parts of the brain. Even the auricular nerve, which affects the ear, is connected up to the vagus nerve, which is connected up to the gut. I mean, hello, it makes sense when you think about it. If your digestion is being affected and the brain is affected and there's some telephone cable between both of them, maybe there's something wrong with the telephone cable or the connection on either end. Makes sense to me. But remember, what the saying I always use, common sense isn't very common today. You know, we tend to think that tinnitus is some sort of a problem in the head. But of course, you know, we're not talking about Meniere's disease. We're not talking about, for example, decalcification of bones, small bones in the inner ear, because the smallest bone in your body is in the ear, by the way. We're not talking about industrial deafness. We're not talking about your wife or your husband screaming at you all the time, creating, you know, what I call selective deafness, right? Or your teenagers driving you crazy, or your dog, or in my case, the parrot screaming all the time. We're not talking about noise here. We're talking about tinnitus. We're talking about fluttering sounds or crazy sounds in the ear. My mum had tinnitus for years. I notice it's a condition, a little bit like Meniere's disease, like the dizziness that some people get, seems to affect a lot of people in their 50s and 60s. The interesting fact also is many people with tinnitus have got gut issues. So if you're watching this video now and you've got some kind of digestive issue like burping, bloating, gas, flatulence, constipation, or difficult bowel motions or loose bowel motions, anything like that. If you're a person watching this now who's been on an antibiotic, particularly something like tetracycline, for example, that's linked definitely with tinnitus. If you're a person who's been on a medication long term, my recommendation is to get your gut checked out. And if in doubt, treat it out. Just treat it for Candida or bad bacteria and take maybe a good probiotic enzyme formula. See what happens. You've got nothing to lose. It's definitely worth a shot. So as I mentioned, it's been a year since I've done this video, but I've almost certainly noticed a connection between tinnitus and digestive disorders. So please look at some of my other videos on Candida. Familiarize yourself with this. Treat for Candida or treat for dysbiosis and see what comes out of it. You've got nothing to lose. Thanks for tuning in.